Now coming to the assessment of mood. Assessment of mood is very important when it comes to disorders like bipolar disorders or other mood disorders like depression and anxiety spectrum disorders. So basically, mood. What is mood? Mood is a pervasive, sustained emotion that colors the person's perception of the external world. So, which is something pervasive and sustained. So, how you can assess the mood? You can ask questions like, how you have been feeling in the last 1 week?
I have not been feeling very good. I've been feeling quite low.
Sometimes the person may have difficulty in expressing what they feel. So we call that as alexithymia. Or some patients with depression can tell that I'm not able to experience pleasurable activities. I'm not able to experience pleasure like how I was enjoying certain things earlier. So that is basically called anhedonia. So then coming to the assessment of affect. So what is affect? Affect is the patient's current emotional responsiveness. So currently, how is the patient reacting to you? So assessment, you assess affect under these headings. That is the range of emotions, the reactivity, the mobility, intensity, and appropriateness. So what does range mean? Range means whether the patient is able to experience all range of emotions or not. Reactive means how much reactive, and what is the and intensity means what is the strength of the affect, and mobility means how well the patient is able to shift from one emotion to other. So that becomes mobility. And does the patient appear what they are telling? Supposing if they are experiencing sad ideas, that do they appear sad? So that is called appropriateness. So to assess these domains, we can ask questions like, can you recall an incident in your life that made you feel very happy?
When I got through my engineering college, I was really happy because I really wanted to get through that.
Can you recall an incident in your life that made you feel low, sad?
Yeah, when one of my cousin died, I felt really bad because my cousin was really close to me. So that day I still can remember it.
So as you can see here, there is a wide range of emotions that are noticed, and it is appropriate, incongruent with her thought process, and there is patient who is able to shift from the happy affect to the sad affect. There was intensity of the emotions were appropriate, and she was reactive to the stimulus. So this is about assessment of mood and affect. Now then comes to the assessment of perception. So what are the perceptions? That includes hallucinations, illusions, or depersonalization or derealization experiences. So what is hallucination? In simple, hallucination, it's a perception without any external stimuli. Illusion is a perception, altered perception with an external stimuli. So for example, a rope may appear like a snake. So here there is an external stimuli, but the person is misinterpreting it. So that becomes an illusion. So how do you ask for these hallucinatory experiences? Initially, you can start with an open-ended question, any unusual experiences. Then if the patient starts telling, like in the assessment of thought, she had already talked about hallucinations, so had demonstrated few things about hallucinations. So I'll ask it again. Of late, have you been experiencing any unusual experiences?
Yeah, I hear two people talking, blaming each other, but it can't be heard by other people. I don't know why.
Okay. So who are these two people?
They are my relatives. One is my maternal uncle and one is my paternal uncle.
So what do they tell you?
They keep blaming each other, and sometimes they blame me also. They say that, you're not doing things correctly and you're not good enough. So they're always blaming.
Do these voices come from an outside world, or it appears like they're coming from within yourself?
No, it's coming from outside.
Clearly.
It's like they are speaking.
Okay. How far does it? From a nearby place or a very far off place?
From nearby place.
So how do you react to this?
I try to leave the room because I get really irritated when they just keep blaming each other or blame me. It's very annoying.
So these are basic domains under which you can assess an hallucinations. Basically, I tried to know whether whether it was a second person auditory hallucination or a third person auditory hallucinations. So whether if the voice is directly talking with the patient or commanding the patient, it's called second person. Or if there are two or more voices that are discussing among themselves, it's called third person auditory hallucinations. And here we need to differentiate between pseudo and true hallucinations, because true hallucinations signify psychotic disorder, schizophrenia. Pseudo hallucinations may not signify. So to distinguish this, I asked the questions like whether the voice is coming from within yourself or outside. Outside voices are more signify psychotic spectrum, whether the patient is able to control these voices. So pseudo hallucinations, the patients will be able to control, but true hallucinations, they don't have control. And I asked about acting out behavior. The patient that she was leaving the room, it was making her feel irritated. So that was the impact of those voices and the acting out of those voices. The general appearance and behavior, the speech, mood, thought, perception. Subsequently, Sandeepa will be demonstrating how do you do the further steps in MSc. Thank you.